Good morning, everybody. It's Dr. Pearlman, and I am back with another video. And it's been a little while since I made a video like this or any sort of meaningful content, at least I think, or feels to me like it is that way. Because we all have, things that come up, right? And I'm not even going to begin to make excuses or begin to let you know just how awful this last month has been in terms of just inconvenient things. So I'm not even going to rattle off a list, but just know everything is okay. Everyone's alive. Everybody's well. And, me and Dr. Axel and Jen and the family, we're doing okay. So here's the deal. I've been consuming a little bit more content in recent weeks about some clinical pathology or clinical findings in certain very severe cases, nothing to do with back pain, but have a lot to do more with like why people are dizzy, why people have constant headaches, why people have trigeminal neuralgia and pain in the face, right? Sometimes just called, TMJ symptoms. Other things were different classifications of vertigo and why people might be dizzy and various reasons that they could be dizzy, not just the traditional, oh, there's crystals in your ear that are off balance, let's do an Epley's maneuver. There's been a lot of content that I've been consuming. There's been a lot of articles I've been reading. There's a lot of case studies I looked at. And one of the things though that bothers me as obviously a chiropractor and a clinician, and I think somebody that, now 5 years into practice, that I have seen enough to sort of gauge that it's really unfortunate that people who bash chiropractors do it from a place of just really complete ignorance. Like they don't understand chiropractic at all. So when they see adjustments on YouTube, really what they're doing, and nobody talks about this, so if you're into 2 minutes of this video, now you'll finally get a little bit more of what I always call the truth, right? There is a turf war going on, and it's not some intentional thing where, it's a turf war. The chiropractors are here with other alternative or thought to be alternative medical minded people or holistic healers. And here's the mainstream medical MDs and their big, reimbursements, and they're in with insurance and they push the pills and do the surgery. It's not even like that. It's sort of an innate, subconscious, built-in thing that says, oh shoot, I don't understand what they're doing, or I don't understand why they're doing it, and I can't really take the time to guess or go down that rabbit hole because it will consume me. Therefore, I'm going to just write it, that's not anything anyone needs. Oh, that looks scary and unsafe. I can't see how cracking someone's neck will help them, let alone the assumption that mainstream medical people mostly feel that we as chiropractors tell people we can fix them and we can fix their underlying cause or get to the underlying cause and fix, their issue, which is not true for 99% of the providers that I know and that I've seen. I think there's teetering on the edge with various chiropractors in particular who do kind of oversell a little bit of what the adjustment can do and what it is. And I'm going to talk about that. And then I believe that there are other, mainstream medical people that also are like, yeah, if chiropractic works and it makes you feel better, great, use it. But then they'll kind of also wiggle back into that room. But don't let them sell you on lots of visits and all this stuff. But here's the thing. Let me address that right now. Lots of visits, chiropractic. What does that mean? I'm going to give you the very short, quick, down and dirty answer. I'm not going to carry on about it. What is the alternative to pain management, right? If you looked at chiropractic, which for a lot of us out there, and me included, chiropractic, when I go, a lot of it is pain management. And without getting too deep, again, pain management via chiropractic, what is the alternative? Are you going to take oxycodone? Are you going to take Percocets? Are you going to take, any other type of opioid that could be potentially deadly? Do you want to become dependent on fentanyl until you can't breathe one day and you die? I mean, do you want to take Advil at 500 to 1,000 milligrams a day until your guts just bleed out? Because that is the inevitability of taking NSAIDs. That is the inevitability of being reliant on opioids. I'm just telling you what we all know is true, mathematical, objective data when it comes to bodies being studied after people pass on. When family members say, yeah, they had a drug addiction, they had a fentanyl habit, they had an opioid habit, they had a reliance on using these pills because it started out they were in so much pain. So now I'm going to ask you, the viewer of this video, is somebody who's going to the chiropractor to manage their pain that feels like it's acute over and over again, even if it's not fixing the problem, is that person making a bad choice? And is the chiropractor providing that service a bad person? That takes me to the second part of this video, or at least the second part of this elaboration, because I'm going to talk about the chiropractors and what we say about MDs as well. Don't you worry about it. You know, the chiropractors providing this service are doing exactly what we know worked for us, that sort of led us down into the road of becoming chiropractors. And that is that there is no other modality that is that powerful and can reduce pain and increase range of motion and sort of take you out of that fear avoidant behavior, which fear avoidant behavior in the realm of like medicine and what I talk about, and what a lot of other people in my realm of like osteopathy, chiropractic, physical therapy, orthopedics, kinesiology, whatever. Fear avoidant behavior is like not moving your body in positions or not doing certain acts that have caused great deals of pain. And usually the people that live in fear avoidant behavior, it's because they felt pain that is so great, symptomatically so great, that they are like truly scared to bend over and tie their shoe. They're truly scared to pick up the child. They're truly scared to pick up the dog. So when you're in that type of position, you really want to know a good chiropractor. I'm just going to tell you straight up. And then you know what, again, the MDs might say, oh, well, yeah, no, of course. And it just as long as you know that it treats the symptoms and it only affects the facet joints and all this stuff. So that's my piece on that, which I also now want to take it from the chiropractor side. So chiropractors, you can't just write off the need for medical sort of allopathic or mainstream intervention at times. Number one, are you going to be diligent and are you going to write the advanced scan? If you're not in with the insurance, or if you as a non sort of looked at provider that the insurance will then just green light an MRI, a CT, a bone density, a radio frequency, I was just trying to think of the radiotide graph when you want to look for hot spots for cancer. Are you going to be able to get those, scans approved right away? The answer is probably not. So a lot of times there is a need to refer. Just educate your patients, inform your patients of what we're looking for, of what there could be, a problem about. The other thing I was going to say is chiropractors, like, it's okay if somebody needs to do exercise. It's okay if somebody has the ability to rehab, right? Not the ones that are so far gone that do rely on us as opposed to opioids. Not the ones that should rely on chiropractors because of that maintenance, wellness effect of keeping chronic pain under wraps. And if you out there are like, oh no, there's no need for that because exercise and it's, look at the case studies. Guys, case studies, peer-reviewed literature, the evidence. Guys, stop. You don't know what you're talking about. If you've walked in my shoes for the last 15 years, you would know why people rely and utilize chiropractic consistently. And I've had laminotomy, foraminotomy, decompressive lumbar surgery, and I still go to the chiropractor every 2 weeks to get checked. And yes, I get adjusted when I get checked. And yes, it makes the biggest difference in my day-to-day functionality and how I feel and how I function, because that's the synopsis of coming back to this again. Is like chiropractic is about functionality. Chiropractic is about adaptability. Chiropractic adjustments is about the brain stimulation to the spinal cord, and that is it. That's what it's about. It's not about alignment. I know a lot of people out there say people come in for their alignment, and the reality is we don't say it, but it's because it's easy to explain to someone who is a novice, non-educated consumer of kinesiology, biomechanics, physiology, anatomy, right? If you had to explain to everybody about the pathways of pain inhibition and the pain gate cycle and nociceptors and mechanoreceptors and stimulation and which pathway up to parts of the brain are like sending signals back down to the spinal cord at certain levels, and what parasympathetic and sympathetic look like in terms of like how your body is responding to a certain stimulus, whether it's temperature, pressure, touch, vibration, right? Whether you wanted to take someone through red light therapy, shockwave therapy, vibration, or just percussive therapy, sound waves, right? Like all these different modalities that exist that can help people in so many different ways, they are going to be overwhelmed and they're going to be lost and they don't know what to think. So if you say your bone is out of place and I'm going to realign it, it's easy for them to understand. But then when Mr. MD out there hears it, or orthopedic doctor from Canada hears it, they have nothing but disgust for us and think that we're these big lying quacks. And that really is unfortunate, because I believe that you can kill two birds with one stone here. I believe two birds, one stone. I believe that you can do the education from the perspective of, we are stimulating your neurology. We are stimulating your central nervous system, brain to body, body back to brain. And that cycle is going to sort of reset things. When your brain tells your body that it's okay to move with greater range of motion and less pain, just on pain cases, symptoms reduce, better function. That's the gateway into being able to do rehab, self-exercise. A great friend of mine, a mentor who's been amazing to me, Dr. Martinez, talks about nutrition, exercise, you don't want an exorcist, nutrition, exercise, mindfulness, and sleep. And, I talk about don't get hurt, right? Rule number one is don't get hurt. I say nutrition and exercise is together. I talk about sleep, being rest, repair, and then adaptability, ability of the body to adapt. Let me tell you something. Chiropractic, again, all about adaptability. I'm not going to ramble on about it anymore because this video's gone on too long. But guys, in closing, here's what we have to remember. Chiropractic is about maintenance of the nervous system, and it is about being able to adapt. If you think about it just from a pain standpoint, which it is great at reducing pain in the moment. Yes, it reduces symptomatic pain. But it is about, once that good adjustment has been felt, that cathartic, that, it's so satisfying. When people who have felt that, and come off my table and many other chiropractors' tables out there, they are now at that moment of like, there's the gateway. What lifestyle choices that meet the mindfulness, sleep, exercise, nutrition, right? You've heard me say this now coming up in videos in the past, what can you do for yourself that you're honestly looking at yourself in the mirror, and what can you do to say, I'm going to make these micro habits, these good habits daily, and I'm going to begin to do all these things, whether it's the chiropractor and the active therapy of like physiotherapy, exercise, going to the gym to work on like stability, being at home, body weight free, core exercises, and understanding how to do it without getting hurt. Say you're someone who's dizzy all the time. Say you're someone who has frequent migraines, and chiropractic works to sort of get the symptoms under control. I leave your office feeling better, and then I don't feel symptoms for a couple of days, and they come back. What other medication are you on that may have a side effect? What other supplements are you using that may be causing a side effect? What other foods are you eating that are causing a trigger? Have you gotten your blood work? Do you even know if you're pre-diabetic? Do you know what having true pre-diabetes or diabetes does to your body? Do you even know what it is to be having episodes of syncope where you actually are like fainting or near fainting because of issues with blood pressure or because of issues with, inflammation due to poor diet that is causing blood sugar fluctuations, which then could indirectly or kind of semi-directly correlating with blood pressure issues, and each of these could be causing you to feel dizzy when in actuality you're lightheaded and what they call positional, vertigo, or what they call tachycardic, positional effect. I can't think of the word right now. I think it's POTS. Positional orthostatic tachycardia, and I don't know if the last word is symptoms, but now that I, said that, see, this is all organic. I don't need to edit anything, but is it positional orthostatic hypotension type of symptoms? These are things that going to a practitioner that's able to help diagnose it will get you, the answers. But here's the thing. Once you have the answers, again, what are you going to do about it? A lot of this boils down to symptom management. You hear this so much when you watch enough lectures, and believe me, I've watched a lot in my time. A lot of the biggest, best, most followed doctors in the world will give you this great presentation for an hour, only to tell you that you need to find therapy to manage your symptoms. And again, what did I say in the beginning of this video? What are the alternatives? Like, what are you going to do? What are the alternatives? You're going to swallow pills for the rest of your life? You're still going to live with symptoms. You're still going to have effects. One of the greatest quotes I ever heard was, there's no such thing as side effects, because what comes along with a lot of these medications is there's nothing on the side about them. They are direct effects from being on the drugs that will cause a different problem on top of the problem you already have. And it's a vicious cycle. It really is. And that is, am I saying chiropractic is the answer? By the end of this video, you should know already. No, I'm not saying that chiropractic is the answer. I'm saying that chiropractic is a necessary wellness component that is a part of your life to manage, not just symptoms, but help your body adapt to the environment, because that is a lot about what endorphins are. That is a lot about what the stimulation and the feel-good high is, okay? There is a big body of literature. If you look at Heidi Havoc's research out of New Zealand, if you look at and listen to a lot of like the most modern biology of life, Bruce Lipton, if you kind of allow yourself to hear what that is when it ties back into like the ideas of like epigenetics, if you think about the neurophysiological, psychosomatic components that go along with symptomology, it's incredible what can happen when you begin to feel some of your symptoms reduce, and I got caught up in my head right there. I almost wanted to address the placebo effect, but it's too ridiculous to even say that, because most people that come to the chiropractor, especially older folks, which by the way make up like 90% of our population that sees chiropractors, older folks with neck and back pain, they come in with their arms like this, and they're so not pessimistic, excuse me. They're so, God, I can't think of the word. They don't think it will work. They have these negative expectations. They're like, how is cracking my spine going to make my symptoms better? And what's sick is the ones that stay for like a week and then become these wellness maintenance, if you will, patients who help with manage their symptoms. They're so happy that they did, and they always say, why didn't I do this sooner? And their body language completely changes because they realize that this is happening. And here's the thing. It's a nocebo. Like they have the most appalling, expectations. Like they feel like it's impossible that it could work. They're only on the table expecting a miracle. They want the miracle. Nobody talks about that, right? Like they want a miracle fix and they want it now. They won't say that. They'll humor you in the office. They'll look me dead in my eye and say, oh, I understand the process. I understand the process. No, they want to get fixed. But someone like me, and I hope that a lot of you all other providers out there say, look, we probably won't fix this once we've seen the imaging, right? Once we've gone into the history. But can we have a lot more good days than bad? Can we reduce the symptoms by like 85%, whatever? Oh yeah, and they would love that, right? And what's crazy is their quality of life improves exponentially. And they didn't come in with some, oh, I think this is going to be what heals me. No. If anything, they're pessimistic about it. They really are not into the idea of how cracking their back or their neck or their whatever is going to fix them. And they all are better off after having that negative expectation. So it's not placebo, guys. Are there placebo effects? Sure. You can look at plenty of the studies that talk about the sugar pill and everyone's symptoms going away. You can look at all the control groups and the non-control groups and the placebo and the effects and the peer-reviewed literature. You can look at it all. And I know there's also a lot of people who love to take chiropractic videos and cherry pick what they say in it at a frame in time and then talk about how there's no difference between that and, again, exercise. I have to go back to that all the time, because if you've had the pain that some of the people that I've worked with have had, there are no exercises that you can comfortably do until you get the adjustment to make way for that active recovery and those exercises to be effective. So, guys, once again, in closing, thank you for tuning in. I really do appreciate the people who do consume this content. I really do appreciate the people who value what it is that I and what we do as chiropractors who do it the right way. And if you have any questions, just drop them in the comments. Reach out to us at drpearlmantv.com. That's the DR one, all one word, drpearlmantv, drpearlmantv.com, and you can find all the content, all the different, social media avenues there. We're in Dallas, Texas. We're always taking on new patients. We want to help as many people as possible. So if it comes down to having my doors open whatever amount of days a week, if it comes to helping you, get better, like that's what we're here for. That's what we do. I appreciate you, everybody. Have a great day.